Hey everybody, it's Sharon Simpson here. I'm the Director of Community Enrichment at Menno Place, and I thought it was important for us to give you a little update on what we're doing with visitors and in long-term care, Menno Home, Menno Hospital, and in assisted living, Terrace East. So as you know, we had the big announcement on June the 30th from Dr. Bonnie Henry, our Public Health Officer, and she announced that it was time for visits to start again for people who live in long-term care. And so that includes Menno Home. We have 196 people that live in Menno Home. Menno Hospital is also residential full-time nursing care, and that has 151 people. And then we have Terrace East as our seniors assisted living apartment building with 96 apartments that are specifically providing some level of care, a little bit less than what people are getting at the long-term care. So you are probably wondering, what are we doing? And I wanted to just give you an update. A lot of you have called, and we thank you for your phone calls. We know more than ever how much our residents are loved. You know, I've often thought in these last few months, when people say, you know, people are just dumped off at some care home and forgotten. Well, yeah, it's not the case. The most of the people here have a loved one who are just really, really suffering in not being able to come and have a visit. Did you know we have 63 couples, so spouses or partners who live here at Menno Home or Menno Hospital, and 8 of their spouses live in the apartments. And so that's been really hard and really challenging for people. I'm going to read a little bit about our policies and our protocols, and then I'll do some frequently asked questions. So thank you, first of all, to all 182 of you who filled out our survey about family visits. It just means the world to us that you did that. Your feedback, your input, that's just a game changer for us, so that we know what you're feeling, and we're really grateful. I'll do a little update on that as well as in another video. So our general protocols come from the Public Health Officer and our Regional Health Authority. You can read this next list that I'm going to read on the BC Centre for Disease Control website, which outlines what these visits are going to look like. So some of your questions will be answered right away here. You cannot visit here if you're sick or you have symptoms of COVID, or if you're self-isolating because you may have been exposed or recently traveled. And that includes the United States. Only one designated person is allowed to visit. So some of you have asked, can I come one week? Can my sister come the next week? That kind of question. And the answer is no. This is one person that is designated to visit. All of the visits have to be booked in advance. Visitors are going to be screened for signs and symptoms of illness, including COVID-19, and there's a specific list of questions that we're going to ask you, and I'll talk about that a little bit later. All visitors are required to wear and to bring and wear their own mask. It has to be worn for the entire duration of the visit. Visitors will clean their hands before and after the visit, coughing or sneezing into your elbow, you know, like this, and you can't touch your face. Visits will take place in a specific visiting area, and that's organized. We're organizing that and working on that. And visitors who are visiting with seniors who have mobility issues, we will assess those individually each time and then take a look at what we can do there. These are no-touch visits. So this is probably the hardest thing that I'm going to say in this whole time. No-touch visits means that there's no touching. So you will be more than 2 meters apart, or there will be a barrier between you. We know this is going to be really, really hard. We've seen hugging in our gazebo where we have socially distanced visits, and it's not safe. So it's not going to happen with our vulnerable residents here. And then visits are going to cease if there's a COVID outbreak declared. So what you need to know is that a COVID outbreak is called when one person, either a staff member or a resident, is positive with COVID. So even though we have 151 people living in the Menno Hospital behind me here, just one person it needs to be positive, and then it's considered an outbreak. So where are we at, and why haven't we started our visits? So you probably remember on that June 30th announcement that after Dr. Bonnie Henry finished her talk, Adrian Dix, our Minister of Health, got up and said to all of the care homes that the government will provide up to 3 full-time employees per care home who would be able to assist with the visits. So as you can imagine, you think about what your life was like when you were visiting your mom or your dad or your loved one here every day. You probably helped them with their meals. You were helping them maybe with their clothing. You were doing things for them, outings and errands and coming back in. You were doing a lot. What a gap in the way that things function as soon as we had no visitors. It's just really been a different way that it's gone forward. And we miss you. Like, that's just the truth. We just miss the love and care that is provided by our visitors and loved ones. And so you can imagine the work hasn't really changed. It's actually increased as we move forward. And so when Dr. Bonnie Henry announced the visits would start again, and Adrian Dix said that there would be up to 3 full-time employees per care home, we started hoping for 9 employees, 3 for the home, 3 for the hospital, and 3 for Terrace East. And you might be wondering, what would those people be doing in order to facilitate these kinds of visits? So as you know, seniors over 80 are the most vulnerable population for this COVID-19. It's fatal for people over 80, and we have worked very hard, and I know you appreciate it because you sent beautiful notes of appreciation to us for keeping your loved one safe. So we are working very, very hard at continuing that. When we think about our population whose average age is 86, knowing that when one person gets ill in a care home, it can spread really, really rapidly, we want to be very, very careful. So this staff person that comes, or the 3 staff people, they would be part of scheduling visits, making sure that they're booked, when they're starting and when they're stopping. They would make sure that the resident who's getting a visit would be the one that's, in the right spot. So they'd go to their room, transport them. And I know our recreation staff have been absolutely amazing. You might not know this, but they stage the room before your loved one has a Zoom call. And what are they actually doing? They make the bed, they clean up some of the stuff that's lying around. They want you to see your loved one in an environment that is pleasing to you and also shows how well they're doing and the good care, and they're really careful. They want you to feel really good about it. These people that are going to get your loved one to the right spot and prepare the area that they're on, whatever side of the barrier or whichever space they're in for visiting. They're going to make sure that they're in there and they're safe. And then they're going to be dedicated to ensuring that when you come to visit, all of the control measures are implemented for a safe visit. They're going to screen visitors to make sure that the visitors do not enter the building if they're sick. They're going to ensure visitors wash their hands before and after the visit. And they're going to make sure that people are practicing respiratory etiquette. They're going to ensure that you're maintaining a safe physical distance of at least 2 meters from all residents and staff. And they're going to support the monitoring and protocols for enhanced cleaning. So they're actually probably going to have to do the cleaning as well. So we are required to write up a safety plan and provide that safety plan at any time to Fraser Health or to Fraser Health, who follows our licensing and regulations, and we have to be able to just say, this is what we are doing to ensure the safety of our seniors. And in that safety plan, we're at a little bit of a loss in how to write it up without knowing for sure how it's going to work with these new employees, and we're waiting. So it's been over a week, and we are not entirely sure how it's going to work to have the funding for those 3 additional full-time employees. So that's where we're at. It's a bit of a waiting game, but we want to do it right. And when we did the survey, we know that the majority of you, the vast majority of you, strongly agree or strongly agree. If this is done right, you feel confident. And so that's what really matters to us as we're moving forward. When we start having visits, we really want you to know that it will be the 63 spouses or partners that will be the first to visit. That's going to be the first set of visitors. So if you're a daughter or you're an uncle or you're a cousin or you're a friend, you just need to realign yourself and your hopes and expectations to know that you will not be the first ones visiting. It's going to be the person who hasn't seen their spouse. And that makes total sense to you. I know that, but you probably didn't know that there's 63 people. It's going to be very hard to have a no-touch visit. And for some of you, you've actually written to us or said to us, not going to work out. You know, my mom or my dad or my mom's husband has dementia. They're not going to understand that, and it's not going to be a best case scenario for us if we can't touch each other. So those are the protocols that we're going to follow. I'm going to go a little bit more in depth now and tell you some of the answers to your frequently asked questions on your survey, if that's okay with you. And so here they go. What am I going to be required to do in order to be a visitor? So you're going to have to be verified as the one designated visitor for your loved one for this initial phase of visits. So it was indicated through Dr. Bonnie Henry and Adrian Dix that there would sort of be an initial time, and then they hope to reassess the protocols after this initial time of visiting to just, I guess, get an idea and see what people are thinking is working and what's not working. So in this time, we're going to have that one designated visitor. It will probably be the spouse or the primary contact. Now, some of you filled out our survey and you indicated that you want to be that designated visitor. And what we're saying to you is we're going to call you and we're going to let you know if you're the designated visitor. Once you've been verified as the designated visitor, then you're going to go on to a website that we provide and you're going to book a time. And it's just like the Zoom calls. If you haven't had a Zoom call, you can go to mennoplacelife.com and there's two big blue buttons on there. One that goes to Menno Home Zoom call bookings and one for Menno Hospital Zoom call bookings. And we don't have them in the apartments at this time, but you would just click on one of those buttons and you can set up a Zoom call. It's going to be that easy to set up your visit. Now, if you don't have a computer or you don't like using a computer, or that's going to be a barrier for you to set up a visit, then you're going to call our receptionist. But you don't do that until we really give you the launch of our visit program, because they're not going to be able to actually answer you and book a visit there with you yet. Our booking calendar is really awesome. So if you're a person who supports a family member, a loved one that's going to be the visitor, you might want to use this booking calendar and put your own email address in. It has reminders, it has online cancellation. Even if you phone the reception desk, they are going to book into the calendar so that we have one big booking calendar for Menno Hospital and one for Menno Home, and we don't get double booked, which would be really, really tough for you. I want to talk a little bit about following all of the infection control protocols. So first of all, don't come here and visit if you're sick. And that's any kind of sickness, right? Even though we're in the middle of a pandemic, we still have respiratory infections, we still have gastrointestinal infections, and then we have all of these symptoms for COVID. If you have any of it, don't come. You'll cancel your booking. You're going to identify yourself as the one designated visitor for that resident, and at that time you might be asked for photo ID, and you might also be asked to have your photo taken. And that's for us to just validate that it's the right person that's coming. And that's because we are trying to protect the number and reduce the number of people that are coming at one time in this first phase. Then you're going to participate in the active screening process. And in that process, one of our staff members, probably this new staff member that we hire, is going to ask you the following questions. These are the active screening questions. And by the way, these are the questions that our staff answer at the beginning of their shift and the end of their shift 100% of the days that they work. We also do a temperature, and you might be asked to do your temperature. So that's what the staff are doing, and it's working, right? We're keeping COVID out of here. So these are the questions. Do you have a fever? Do you have a new or worsening cough? Do you have new or worsening sneezing? New or worsening shortness of breath? Do you have new or worsening aches and pains? New or worsening headaches? New or worsening vomiting? New or worsening diarrhea? Are you currently self-isolating? Have you traveled in the past 14 days outside of your community? You're going to bring your own mask. If you say no to all of those, then we're going to let you continue the process. If you say yes to any of those, then we're going to say it's not your day for a visit. You're going to bring your own mask for the visit, and you're going to wear it. And you probably know this already, but I just want to show you how you're going to wear it. You're going to wear your mask over nose and over mouth. And so on these masks, on these medical masks, you then pinch at the nose. There's a little piece of metal in there. You pinch at the nose. For me, I'm a glasses wearer, so my glasses, if they're over top of the mask, they don't fog up. That's how it's going to be for you. There's not going to be any of this. There's none of this, because you still can have droplets. There's not going to be any of this, where it's just sitting on the end of your nose, and there's certainly not this. This is protecting nothing. And so you have to be committed to the wearing of the mask, and we're asking you to do that anytime you're on the Menno Place campus. 11 acres, 700 seniors, you need to wear your mask. And great news, I have 20 smile masks coming, and they've been shipped, and they're coming. They have a little plastic vinyl piece, and I'll put it on our mennoplacelife.com website, and you can buy one if that's something that you think would be beneficial. They're not medical grade, but they are something that they're more hopeful, right? If you have somebody who lip reads, that's going to be really great. I know they're in the mail, so that's coming. You're going to receive all the instruction that I just gave you on how you're going to wear your mask, and if there's any other personal protective equipment that you need to wear. And sometimes you do need to wear goggles, but we're not sure how it's going to go. You're going to go into one of the washrooms or the wash stations, and you're going to wash your hands with soap and water, and then you're going to start your wonderful visit, right, that you've been hoping for. In that visit, if you have to cough or sneeze, you're going to cough or sneeze into your elbow, so that even if you're wearing a mask, you should get into the habit of that anyway, because that's a good way to keep your droplets from not going everywhere. You can't touch your face. You're going to keep that mask on for the duration of your visit, including when you arrive and including after you exit. And so we've just said that masks are a requirement on our campus here. And then you're going to enjoy your visit, and it's going to be in a designated area, and that's the only space that you can be in. A staff member will supervise you from a respectful distance to ensure that compliance takes place and that no objects are passed between yourself and the person that you're visiting. You're going to maintain a distance of at least 2 meters, and it's a no-touch visit. I said that already. And you're going to comply with the visit ending at the agreed upon duration. Wash your hands after you visit, and then you're going to exit. And after that, you're going to go back online and you're going to book another visit, because that's going to be a good thing for you and your loved one. So what are the details about this visit? So let me go a little bit into that. The length, at this time, we're planning 45-minute blocks of time for visits. And the visits will be 30 minutes long, and that will allow for visiting in that one location, or that location to be disinfected between the visits. So obviously after you leave, then this new employee that we get is going to go in, they're going to do the enhanced cleaning. They will have removed your loved one and transported your loved one back to their own room or suite in Terrace East, and then they're going to keep going with cleaning it. The number of visitors, some of you asked about that. It's just one designated visitor only. There's not an opportunity in this initial phase for multiple visits. So some of you are going to have to work that out with your family and with your grandkids and the great-grandkids, because lots of you are just saying, it's time, we really want our whole family to be around. Frequency of visits, so we haven't determined that. We don't know yet. That's going to be based on our staff capacity to facilitate those visits. And the location, so the location will likely be indoors. Some of you have talked about outdoors, and that might be something that can happen in the next phase. We're going to start with some indoor locations. In case the weather isn't great, we don't have to cancel. It's not as disappointing. Weekend and evening visits, again, this is going to be determined by the staff that we are able to hire. And we consider it important for you to be able to visit when you are able to visit. And some of you said, I mean, hey, I'm working full time and I don't work in the valley and I have to drive out to Abbotsford, and so are we able to visit on the weekend or evening? So that would be our goal, is to be able to set that up. Can you bring something And many of you talked about lovely treats. Can you bring treats? And the answer is no. We have a policy, an order from the public health officer and our medical health officer that says that you may not bring anything but essential deliveries. And so that's really, I know it's been challenging for you and for residents. People have asked for magazines and for chocolates and for lots of other things like that. And we're just saying at this time, we're just trying hard to comply with our medical health orders. Mobility. If the resident has a mobility challenge, what will happen? And we're saying the visit will be assessed individually and the visit will be accommodated. Will there be a plexiglass barrier? Well, we're still looking at that. We're probably going to start with a barrier. And can you cancel a visit? Absolutely, you can cancel a visit. So, and then we may have to cancel the visit, right? That depends upon staffing and if it's an outdoor visit, whether or not it's nice out. How does COVID affect or impact these social visits? So the first part, which I talked about at the very beginning, is if you have any symptoms or you're in social isolation or you've recently traveled, you can't visit. So that's really important. And we need you to be honest because that is not going to be okay. And some of you said, you know, I know that I'll follow the rules, but will everybody follow the rules? And that's what's important. Everyone has to follow the rules. And if there's an outbreak, remember that I said only one person has to be positive with COVID for it to be called an outbreak. One person out of 196 at Menno Home, or one person in 151 at Menno Hospital, or one person out of the 96 in Terrace East, that's called an outbreak. And when that happens, we shut down the visiting. And so it's really important that we do not at all bring infection or COVID into Menno Place. What if there's a second wave? And of course, it's possible that once again, if there's a second wave, we would have to lock down the visiting. And so I guess in a way you have to be prepared for these things. None of us really want this. It's a global pandemic. None of us hoped for it. None of us feel good about having this situation where there's not open visiting. We all miss it. We miss it. We miss seeing you. And it's been hard for all of us. So that's the update. And I hope that that helps with some of your anxiety and questions and helps you as you navigate forward. We will let you know once we know about hiring those additional people. And that's really where we're at this point. And I hope that you can understand that and we'll keep you posted. That's our main thing. We'll keep you in the loop. Have a great weekend.